Welcome to the 73rd Annual AHCA NCAL Convention, and today at the Provider Lounge we have Samaria Washington, who's the Regional Director of Operations for Bridgepoint Healthcare. They have two facilities in Washington, D.C., Capitol Hill and National Harbor. Samaria, welcome.
Thank you. Thanks for having me.
Oh, so welcome. We're interested, the viewers are interested in hearing on what do you think that the industry at this point in time needs, from the government, from the resources, or the community, in order to, keep on going in the right direction?
Well, I think that we need their grace. COVID-19 was a very traumatic experience for us all, and long-term healthcare really took the brunt of the effects of COVID-19, and we're still in the throes of it, We're already very heavily regulated, and then the extra regulations and requirements from COVID-19 have really put a strain on our industry. We're coming up with exciting ways to address these issues, and I feel like we need everyone's grace. It's our teams are hard workers. They love the residents and the patients that come to us, and they work really hard.
Yes, and I know your facilities. I've known them for quite some time, and they give exceptional care.
Absolutely.
And the staff are so invested. They are so invested, and prior to the pandemic, the organization was all about education and training and giving the tools to the staff members to excel. But in the same light, the requirements, as we all know, from 6/29/2022, they're stepping it up, and it's a lot. It's a lot.
It's a lot. It's a little overwhelming.
Yes.
And I've been doing this for quite some time. But considering the staffing constraints and challenges that we're having in our industry, the additional requirements are really pushing us to the brink. We'll do it like we always have. We'll figure it out. And a lot of my team members and my colleagues, and they're coming up with innovative solutions to try to make everything work. Our biggest thing is we want to make sure that the residents are taken care of. That's our absolute priority. And we want to make sure our staff is okay. So we're doing a lot of things to address staffing concerns, even their personal issues. We're trying to help them through their own personal challenges that have come out of COVID-19. That's what we're about. Bridgepoint Healthcare is like a family. It's our work family. We do the best we can to try to help each other out and be there for each other, as well as our residents and their families.
It's a very strong community, and I've been multiple times. The organization is exceptional. Let's shift gears just a little bit. Talk to me about, you're in the heart of the District of Columbia.
Yes.
And you, from a workforce perspective, how is the supply of talent, staff, how are you doing? I know you have challenges, but do you gauge it? How much worse is it pre-pandemic, or how do you look at it?
It's much worse.
It is.
It's much worse. Our industry has been challenged with staffing for quite some time. COVID-19 really brought it to a head. It is worse than I've ever seen it. But again, we're doing innovative things. We're using technology to try to help. We are looking some positions that may not have been remote positions before. We're looking at bringing some remote characteristics into it. But this is a people business. You can't take care of people unless you're there. So we are somewhat limited on how much we can do with that, but we are exploring every opportunity we can to bring technology in to help us with the workforce challenges. We're also working with the District of Columbia on a number of initiatives to try to get people trained in positions like nursing assistants. And we're also working with nursing schools, to provide opportunities for them to come out to our center to do their internships and their clinicals. So we're doing a lot of different things to try to improve the workforce situation.
And that's excellent. And then just one last question. Technology, again, I perceive that in the last decade it was tough to transition to tech, but I feel, at this last 3 years, they've upped their game, meaning, and so give me some examples of where you think that technology has helped.
Well, we're looking at things like remote patient monitoring to help us. So whereas we may have fewer staff members, we have technology that is keeping an eye on the residents and then notifying us if there's some subtle change that lets our staff know right away that they need to go and check in on someone. We're also using things like I'm drawing a blank on it. Telemedicine.
Telemedicine, yes.
Yes. Transportation becomes a challenge as well, because I think as I'm looking across industries, it seems like most industries are having challenges with getting staffing. So trying to get transportation to get residents to appointments and things like that can be challenging. So using telemedicine to help with that.
So are you saying that the residents today have the option of, instead of getting in the van and driving to the appointment, they do telehealth visits?
Yes.
That's fantastic.
Yes.
Do you do it in a special room, or?
We can do it right in the resident's room.
Really?
Yes.
And how do the residents feel about it?
It depends.
Yeah.
Some of our older residents are like, what are you doing? They want to actually see a physician, and we absolutely can accommodate that. But some of our younger residents, because we are seeing younger and younger patients and residents come in, they're kind of excited about it and they like it. We use an iPad, and they're pretty tech savvy. So they like it.
No, I think it's great, and I'm from Massachusetts, and even in Mass General, they all use it as well. I mean, you can go see the primary once, and then if you have a follow up, they'll do
Absolutely.
it, and it isn't driving in, or it's a great option that, had we not experienced the pandemic and the waiver, we probably would not have this liberty to use it.
Absolutely.
So, but Samaria Washington from Bridgepoint Healthcare, so grateful that you came, font of information, and we hope to see you next year.
Thank you so much.
Thank you so much.
Appreciate it.
Thank
All
you.
right.